In this video, our instructor will be demonstrating how to splint and mobilize different injuries. While there are different ways to do this, our instructor will focus on some of the most common methods patrollers use to splint or mobilize their patients' injuries.
Today we are learning swaths and slings. We have a patient presenting an injured wrist. She's self-splinting, holding the arm so that it doesn't re-injure. First thing we want to do is take a pulse, make sure that it is there. We do have a strong pulse. You take your sling across the folded edge, take the point, and create a little knot. You're going to make a cup to hold the elbow. That way it doesn't fall out. Once you have that, slide the sling underneath her arm until the knot touches the elbow. Make sure that you go all the way underneath the injured wrist. You don't want anything to end up holding onto that injury. The other end goes over top of her out front, around the back of the neck. As you cross over in the back, start to pull and take the tension off. Once the sling is holding the arm, tie a knot and make sure that everything is in place. The final step is a swath. Take your cravat at full length, go around the chest, underneath the uninjured arm, making sure not to go across the injured wrist. You'll tie a knot on this side to hold the arm to the body. Your last step here is to check the pulse and CMS one more time. Very good. Can you feel that?
Yes.
Okay. When dealing with an injured forearm, we'll use a SAM splint, gauze, and cravats. First step is to measure the SAM splint against the uninjured forearm. Support the injured one. While you're measuring it, you want to actually create a little fold at the hand that the hand can grip. If you don't have a SAM splint, you can take a roll of gauze and that will work as well. Slide the splint underneath. Take your gauze. Start wrapping around. As always, it is important not to wrap over top of the injury. We're going to say it's a mid forearm. Next step would be to sling it. Come in with your sling. Take the elbow over his shoulder. Let the arm drop down to the body. As you tighten the sling, take the weight of the arm in the sling. Make sure that the sling grabs all the way up to the wrist. I have it now. Let go. Alex. Once the sling has the weight of the arm, your assistant can actually step back. A regular swath underneath the uninjured arm, across the chest, tying a knot on this side to hold the arm firmly to the body. Last step is to check CMS. Getting as close as you can. Yeah, we can get to the wrist. Good pulse. Can you feel that?
Yes.
Okay. To immobilize the hand and wrist, we're going to take a SAM splint with a roll in the front, slide it underneath, you have the patient wrist grasp in a position of comfort, then your assistant can actually hold on right here. Start at the upper end of the arm, wrapping around down towards the wrist. Keep a wide band over top. Catch the hand over the knuckles, under the thumb if it's not injured. Work your way back up the injury, or back up the arm. Tying your gauze underneath. At this point you can splint, or you can sling the arm. Grab the elbow. Lower the arm, please. To her hand. Again, let the sling take the weight of the injured arm. Let go. Tie a knot in the back, behind her neck, and we will swath it around the chest, encompass the arm. Tie a knot. Now with an injured wrist you will not be able to check pulse because the injury is covered, but you can check the fingertips. Do you feel that?
Yes.
And even check for blood flow in the fingers. When presented with an injured elbow, choice is to splint. You can make a splint out of your SAM splint or the wooden splints in our patrol bags. Alex will help us. First thing we want to do is support the injured arm, take it away from the patient. You want to hold below the injury and above the injury. In this case, a joint, you're going to hold the forearm and the humerus. Slide your wooden splint underneath and one over top. The object is to sandwich the arm between the boards, leaving the elbow exposed. At this point, you really do not want to bump into that elbow. You can use cravats or gauze to wrap. You're going to start your wrap here. Wrap underneath. Closing your sandwich down. Work your way up the arm, securing it as you go. Carefully slide it between the elbow and the board. Do not rush with this. Use a second roll of gauze to really secure it. After you have the split on, you can check your CMS to see it for a pulse. To sling this injury, you do not want to use a typical sling, as it would encapsulate the elbow and cause the patient discomfort. Take your cravat, hold the two ends together, loop over your wrist, give it a twist, grab a hold, pull through. You're creating a loop. You're going to grab the patient's wrist, hand, slide it over a wrist, pull it tight. You're going to have your helper push it down, put it against her chest. Tying the sling behind her neck. Are you comfortable? Now he can let go. Check for CMS. You feel that?
Yes.
Check her pulse again. To swath this injury, you want to go above the splint, around her hand. Would you tie that for me, please? Making the knot underneath her other arm. This will hold the arm to her chest without, again, touching the elbow, which we want to avoid. One last time, you can check CMS on her. Can you feel that?
Yes.
When suspected injury of a humerus, you want to splint and sling and swath the arm. First thing we're going to do is check for a pulse on the injured arm. We do have one. Can you feel that?
Yes.
To get a proper measurement, always use the uninjured arm.
Take from the top of the shoulder to the elbow. Get a little bend in there. And then you pass it back.
I'm going to simply place the splint right against the arm. Alex is going to hold it for us. Take one of your cravats or gauze. It will work as well if you are in the patrol room. You want to go up to the top, never putting anything over top of the injury. Pull it snug and tie in a knot. Your assisting patrol member should always be holding above and below the injury. If for a bone, you want the two joints. For a joint, you want the two bones. Trying not to move the injured arm as much as possible. Start out. Above your hand. Tie it firmly to the arm. Always a good chance to check CMS again anytime that you've completed a knot. We're going to take a sling, slide it under the arm, over the shoulder. At this point, my assistant can hold the sling, go over, behind the neck, pulling tight, taking the weight of the arm in the sling, tie a knot, check CMS. Now to swath this injury, you do not want to put a swath right across because it would be over the injury itself. You want to make a nice wide cravat over the shoulder and encompass all the injury, and the patroller on that side can now take the swath and tie it tight. Snug it up behind in this position where she won't be laying on it on the ambulance ride or the car ride to the hospital. Final step is again always check CMS. Can you feel that?
Yeah.
Thank you. Today we're going to learn how to roll a blanket roll for a dislocated shoulder. Take a patrol blanket and 4 cravats. As you can see, these cravats have been color-coded on the ends. We'll learn about why in a moment. First thing you want to do is have your blanket in a square. Make 3 folds in it. 1 and 2. This will vary on the size of your patient. You want to have about the distance between shoulder to elbow. Take your first cravat, lay it centered at the end, and start your roll. The next cravat, you're going to lay in that roll again, centered. The third cravat, and then you continue the roll all the way to the end, keeping it tight and square. Once you have your roll, take your 4th cravat, lay it out, and this one's going to hold your blanket roll together. Pull tight, and make a square knot. When you're applying this to the patient, you want to find matching ends. That way you can pull each one and tie them together. If not, and you pull them, you'll end up pulling your cravats out. We have a patient presenting with a dislocated shoulder in a position of comfort. Today we get to use the blanket roll. It's already been set up. First thing we're going to do is check for a pulse on the injured arm. We have a good pulse. Slide the blanket roll into position. Trying not to move the arm as much as possible. And have the patient, since she is self-splitting, we're going to have her help us. Take one cravat, make sure both ends match. That goes down underneath the uninjured arm. Your next cravat, make sure the ends match, goes over top to hold it in place. The last one, underneath the arm. Trick is not to tie it too tight as to cut off circulation. Your last step is going to again to check a pulse and for other signs of CMS. Can you feel that?
Yes.
Okay. Thank you.